us who are not here, right? So what happens on the exam of Lab 2, right? This is just the basic of what I know and how we are going to do our preparation and how we are going to practice, right? This is Dr.Hwd, right? So on our exam day, depending on the situation when your exam is, if you are in the COVID era or the non-COVID era, right, you're going to have 18/16 stations. At the moment, there are 16 stations. You have to pass at least 11 out of these stations, right? Each station is of 8 minutes duration, right? You're going to hear a bell at 6 minutes where they'd say 2 minutes remaining, right? This is the basics. There are 18 stations, depending on if there is not COVID, but because there is COVID, there are 16 stations. You have to pass 11 stations. Each station is of 8 minutes duration. 6 minutes, you'd hear the bell where they'll say that you've got 2 minutes remaining, right? Also, on the exam day, right, on the exam day, you are not going to interact with the examiner. You're not going to paraphrase or signpost to the examiner. This is just like you're going to talk to the patient. They're just saying that as an FY2, are we able to communicate with the patients as an individual, as a junior doctor? That's all they want to see, right? So each station is of 8 minutes duration. You have got 12 marks for each station, right? 12 marks for each station. This is an Aussie exam. This is not an exam where they're going to assess your knowledge, right? Your knowledge has been assessed already. Here, they're just trying to see if you are good enough of an interactor, if you have good empathy, right? If you have good persona or communication skills, right? This is the basics of what we know about it, right? So there are 12 marks. There are 12 marks for each station, which is divided into 4 marks. And how many marks you need to pass? 6 marks to pass the exam, right? 4 marks for your interpersonal skills. That is number 1, interpersonal skills. I'm putting that high up, right? High up, okay? Then there is 4 marks for data gathering, right? You have 4 marks to gather data, all right? Then there are 4 marks for clinical skills, clinical management skills. You see, clinical management skills, not just skills, clinical management skills, right? So interpersonal skills, right? Data gathering, clinical management skills. Each has 4 marks, right? You're supposed to get 6 marks in order to pass. It could be less than 6 if the station is difficult, or if the people who were taking exam with you did not do well and they didn't get good marks, right? You guys, I hope you guys understand what I'm trying to say here. When we were taking our plab 1, there was different criteria for knocks. That's the same here, right? That it depends on how the others performed, right? And it could be that they add in a station or remove in a station, right? So 4 marks for each of them. This is really, really important to understand. This is like the nutshell of everything. And after this, we're going to be doing the error file that GMC has given us, right? So the first thing is your data gathering, right? Your data gathering. What does that mean? What does that mean? That means that, you're going to have 8 minutes. We said you're going to have 8 minutes, right? You're going to have 8 minutes. And in those 8 minutes, you're supposed to do this all, right? This all. Now, what do you mean that there is data gathering? Data gathering mean the basics is that, like when we were in our universities, when we were doing our internships, right? We went to the patients, we introduced ourselves, and we started taking history, right? We started asking them, why are they in the hospital, right? You and I, we don't just go in the hospital for fun. We go there because they pay us, right? So why are they in the hospital? That is number 1, data gathering. This includes what? This includes history taken. This includes your physical examination, right? Like you're supposed to do the examination. This includes your practical procedures, right? Like if you want to do any otoscopy, if you want to do any other exams, if you want to check their septum, etc., etc. Then the lab investigations that you do. This includes all in data gathering. 4 minutes, 4 marks for this. 4 marks for this. And what I've been doing, what we are doing, I told you we have 12 minutes. We have 12 minutes and we spend 6 minutes on it. And this is just 4 marks. Right? This is just 4 marks. I hope you guys understand what I'm trying to say. So data gathering includes the history taken, the examination, the practical procedures, and the investigations, right? That is just your data gathering, and that's just for 4 marks. The second part of your station that they're going to assess is where your rest of the 4 marks come in, is your clinical management skills. Right? I'm going to call this CMS, right? Your clinical management skills. Meaning what? Meaning that after you've took the history, right? After you've done your examination, right? That's what you do. I know you guys, most of us took OET, right? Most of us took OET. When we were writing letters, we were taking the history, right? We first started off with the history. Then in the next sentence, we wrote the examination, right? Then we wrote the labs. What comes after the labs? The provisional diagnosis, right? So your clinical management skills includes what? You forming the diagnosis, right? You forming the diagnosis, what your diagnosis is, Number two, explaining to the patient what your diagnosis is, right? Explaining to the patient whatever the diagnosis is, or what you're going to do further, or what your management plan is. Just talking to the patient, involving him more. So in your management skills, this is where you involve the patient more, where you listen more and talk less, right? Explaining to the patient, because when you explain someone something, right, you talk less, right? Because the other person is trying to understand things. They are going to have questions, right? So this is a part where you need to spend 4 minutes as well, right? Then the third thing there is management plan, right? Management plan, right? These are the 3 things: forming the diagnosis, explaining to the patient what the diagnosis is, or whatever he wants to ask. And the third thing is management plan. Now, we all know this. We are doctors. We've done this. We've done this in our house jobs. We've done this when we were doing our PG exams. What's different here? The different thing here is that we are competing against UK graduates, right? We're competing against their FY2s, right? We're not the normal doctors here. We're competing against their doctors. They want to see if we know the way they do things, right? If we know the way they do things. Most of us are from countries which are underdeveloped, right? Most of us are from countries I'm from subcontinent, I'm from Pakistan, right? Most of us are from the countries which are underdeveloped, and we have a huge influx of patients, and we do not treat them as they are our bosses, right? We don't treat them as they are our bosses. But in the UK, we are treating them as our bosses, right? Like, we care for them the most, right? We explain them the most. We care for their feelings the most. This is really important to understand. This is the basics of this, right? So the first thing, data gathering. Number 2, the clinical management skills. The third thing that is going to be important, which includes the 4 marks out of the 12 marks, is the interpersonal skills, right? Interpersonal skills. Interpersonal skills means what? Interpersonal, you see, it says interpersonal. See, there are 3 terms, right? There is dependent, isn't it? Dependent, right? Like on itself, dependent. Then there is independent, right? Independent, that you are on your own. Then there is the interdependent. This is the same, interpersonal skills. How you talk to the other person. Interpersonal skills, communication skills. This could have been said, like how you talk. They could have said your communication skills, but no, they said interpersonal skills, meaning how you talk to the patient. What is your rapport building, right? Like, how do you talk to him? How do you see the patient? As soon as you enter, you're going to have a cubicle, you're going to enter inside it. Outside of it, there is going to be a chat where the scenario would be written. Rapport building. As soon as you enter, you look at the patient. And you acknowledge what he is doing, right? What he's doing, how is he sitting, what is he doing? Is he shivering? Is he talking? Is he angry? That is your rapport building. Right from the moment you enter is your interpersonal skills which begin. right? So the interpersonal skills are from the top to the end of the scenario. Your history is, you're going to have 12 minutes. Sorry, you're going to have 8 minutes. You're supposed to give history at least 5 minutes, right? The data gathering part, at least 5 minutes, right? And 4 minutes to management. All the time, the whole 8 minutes you're going to giving to interpersonal skills. If you have good interpersonal skills, meaning if you're an empathic doctor, if you're an empathetic doctor, if you're a sympathetic doctor, you're going to pass this exam for sure, right? So the first thing in the interpersonal skills is rapport building. The second thing is open questions. Open questions, right? Like open questions. We're going to do stations, inshallah, and you'd see how we do that, right? I'm also learning myself, but we learn more when we explain things to others, right? So open questions. The next thing is, after you've asked open questions, close questions. We're going to do one station now on CVS, and you'd see how we do it. Then the third thing in the IPS is involving the patient, right? Involving the patient. Are we involving the patient or not? Right? Very, very important, because I just said interpersonal skills. It's not just you, it's a patient. They don't want to see if you have good accent. They don't want to see if if you talk fluently, or if you are empathetic, if you know the empathetic sentences. They don't want to see how you smile, or what is your way of talking, if you're fluent in English or not. They want to see how you talk to the other person sitting there. They want to see how you're talking to the patient, right? They want to see if you're listening to them attentively. They want to see if you're replying to what the patient said, right? No matter what the scenario is, if you're replying to what the patient said, right? They want to see that. Interpersonal, right? It could change. So you have to think that, when you go inside the cubicle, we have to think that it's new. That's what we've not done before, new, entirely new. So you have to be in the moment. Really, really important. The last thing is demonstrating professionalism, right? Like, you have to be professional. You cannot flirt. Yeah, you cannot flirt, right? You should not be making inappropriate jokes, right? This is serious, because when we are working in our setups, we don't understand the boundaries. This is true for the countries that we come from. We don't understand the boundaries. You're not supposed to disrespect the patient. You're supposed to be professional, right? You're always supposed to be a professional, right? Okay, all right. The last thing is understanding the ethics. This is really, really important. And what ethics? The ethics that are used in the UK, right? The ethics that are used in the UK. The countries that we come from, most of us, there we do not involve in the domestic violence, right? We don't have a word, we don't have a say in it, even though we have laws in our countries, but we don't have a say in it. In UK, the ethics says that you're supposed to approach a patient with domestic violence, with non-accidental injury. You're supposed to admit them. You have the right. You're supposed to do things. You're supposed to follow the ethics of the UK, right? This is what it is. This is what is your beginning of plab 2, and these are the three domains which they are going to assess us on, right? So now we're just going to read this file, because this is something which is really, really important, right? Which is really, really important. So let's just go through this one together. I hope I'm not talking much, right? But I like to talk. All right. So the first thing here is examiners have said that examiner in top tips, this is from GMC, how to avoid common errors in plab 2 exam. How to avoid common errors in plab 2 exam. So this is an OSCE, right? They want us not to waste our time. That's number one. Time's money, right? We're going to spend so much. And this is, by the way, most of the things that I'm saying here are from Aspire Academy and from Dr. Mo, right? Dr. Mo Sobe. It's not from me, right? It's from Dr. Mo Sobe and GMC and whatever I've learned. Right, so I'm just trying to pass it on. Okay, so the first thing is that time is money, right? You're going to spend so much money on this exam, right? You're done with your OET, you're done with your plab 1, where you're spending so much money on this exam. This alone is around 2 lakhs Pakistani rupees, right? 2 lakhs Pakistani rupees. Then you're going to stay in the UK for a month or maybe 2-3 weeks. You're going to spend there for the accommodation, for the flight, for the course, for interacting with people. So it's very, very costly. This is why your 8 minutes are really, 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 really important. See, you're going to have an exam of 16 stations, right? 16 stations, which is going to be around 3 hours. 3 hours, right? Really, really important. So let's just read from the beginning. right? What we're not supposed to do. Now we know what we're supposed to do, right? We have three things to work on. We have to work on our interpersonal skills. We have to work on our data gathering. We have to work on our measurement skills. What we're not supposed to do, what are the errors that we're supposed to avoid? When we know this, we'd inshallah be able to understand how to crack this exam. The first thing is listen to what the patient has to say. Examiners are looking for real interactions. This is the first thing we need to remember, that we have to pretend, even though this is pretense, even though this is pretense, we are talking to them as if it is real life situation. Even if it's a simman, even if it's, just a patient there who is an actor, right? You have to pretend like you're doing it for real, like you're working right now in the NHS system and they're paying you for it, right? Okay, so you have to think like that. This means that the questions the candidates ask, the patients can understand. You see, this is so important. This means candidates asking questions that patients can understand. So important, this word, understand, right? Sometimes when we are asking the patient's name, we say, how may I address you, right? That is also the thing that they explain later on. When we say, how may I address you, right? What does that mean? How may I address you? Some of you think, it's like you're asking them the name. The other people who have, a better understanding, or so they're thinking that, how may I address you means that, how are you going to address their situation, what they've come here for, right? So you have to be clear, right? Sometimes we're going to ask them that, is it okay if you tell me about your lifestyle, right? And if you ask someone that, may I know about your lifestyle now, many things about lifestyle. We have different opinions what lifestyle means to us, right? Some of us would be like, how do we sleep? If we are having a posh lifestyle, if we're poor, what maybe the doctor is asking about the socioeconomic status, but lifestyle here would mean diet, exercise, smoking, and alcohol, right? So you just say, may I ask some questions which are, we don't even have to say that, right? We're not supposed to even signpost for these questions, lifestyle questions, because this is standard. They came to us, they knew that we were going to ask them questions, right? We're going to ask them questions regarding their lifestyle, including diet, exercise, smoking, and appetite, etc. Right? But when we're going to ask them questions related to the sexual history, that's when we would be signposting. We won't just say, can you tell me about, what is your sex life like? Right? They'll be like, oh, it's not good, depressed or something. It depends on the response. But we have to signpost and say the words in a way that the patient understands. And that just depends on how the patient is at the moment. If the patient is a child, right? If the patient is a child, right? If the patient is a child or a mother, right? An angry mother, your tone would be different, your words would be different. If the patient is an old man who has Alzheimer's, right? Or if a patient is a man or a woman who has got domestic violence, or if the patient is a girl, a 17-year-old girl who's got anorexia nervosa, your questions about even just one thing, diet, are going to be different, right? The same thing you're going to ask in different way, right? If you're talking to a person who's got anorexia, right, you're supposed to signpost for asking about diet, right? You have to see how you talk about it. So the questions that you say or ask, the patient should understand depending on what the patient is, who the patient is, how is his mood, and when you are asking it at the time of your history taking. Listening to the patient, very important. Active listening, right? Active listening is really, really important. You have to make sure that you're listening to the patient, right? This is so important. When we talk to someone, most of the times we just talk so that somebody else would listen to us. We don't talk so that we would listen to someone else, right? So if you want to be a good performer on plab 2, what I'd suggest and what I'm doing myself is listening to people around me. You practice this in your daily life, right? Listening to the patient, acknowledging him, right? What does acknowledgement mean? Meaning that you look at him, you understand the situation, and you reflect on it. You respond in accordance to what the patient said. This is what it means by listening, right? There are two words, hearing and listening, right? Hearing means that, you hear sounds. You listen to music, right? You don't hear music, you listen to music, meaning you kind of try and understand it. So you need to understand it. So you see, this is twofold. Understanding and listening go hand by hand, okay? They go simultaneously. Okay, and responding clearly, you see, they could have just ended at saying that, responding clearly. GMC is not a joke. They wasted our time by giving us so many deadlines on our plab 1 or plab 2, right? We don't have the seats, we have done so much in this pandemic to just get here, right? So they could have just ended here, right? This is the document from GMC. They're saying responding clearly, sensitively. That means that clearly see who you're talking to again. You're talking to a patient, but you have to see if you're talking to a patient going through divorce, if you're talking to a patient going through some accidental, non-accidental injury, if you're talking to a patient who is depressed, if you're talking to a patient who is fainted, if you're talking to the patient who's hypoglycemic. So depending on who you're talking to, you have to be sensitive about it, right? So this is how we go. So the first, this second sentence is really, really important. This is the gist of it all. This means the questions, you're asking questions, you're talking there, right? Questions the patient should understand, they should listen, we should respond clearly and sensitively. We have assessed your knowledge, and like wasting our time or explaining to the simulated patient, or telling them more about what we know via plab 1 would not help us. You should concentrate on showing the examiners how you interact with the patient, right? This is just about how you would be doing your job as a future doctor. That's all you need to say. Second point, sometimes candidates appear to be using stock phrases, which means it's something they've learned and they're just copying. Meaning that we're just saying that we need Spire notes, we need Sampson's notes, we need Dr. Mo's notes, we need Common Station's notes. Fine, we need to know how to go about it, right? But do not memorize them. Just see how the pattern is. Just see the language that they're using. Don't use rote memory, right? That's what we've been doing in a medical life, right? They don't want us to use it. They want us to be sensitive about it, right? They want us to listen to the patient. Meaning, do not use the stock phrases, meaning that I can understand your situation. I can understand it must be very difficult for you that you've been through this and this. First of all, don't say I understand, right? That's what I know, because if you're telling someone that I understand your situation, for you to understand someone's situation, you have to be literally in their shoes, which is not possible for us doctors, right? Even though we're saying we're empathetic and we're supposed to be empathetic, but do not say I understand. Say I see, right? Or now I understand. You see, the phrase is different. The phrase is different. If I say, for example, somebody says, a patient comes in and say that, I just got divorced. And I tell them that, I understand must be very difficult for you, right? I understand must be very difficult for you. When I say I understand this must be difficult for you, meaning I only understand something when I've been through it, right? So it's incorrect. I should try and say, I understand. If they give me some reason, then I'll say, now I understand why this is so, right? Okay. Or you could say, I see why this makes you upset, right? So we have to use phrases which are non-controversial, non-selfish, right? When we'd be practicing, we'd see what we mean by that, right? So these can sound out of place, insincere. Do not be insincere. See, there are two words. Be sensitive. Do not be insincere. Don't just say things for the sake of saying it, right? Like when you hear about someone's divorce, you say, I'm sorry to hear that, right? But are you really sorry? That is insincere, right? You have to actually show empathy. You have to simulate yourself. We're not just getting simulated patients, we're also going to simulate ourselves, right? And odd if just repeated, right? Okay, so we have to make sense of things, right? We have to be sensible about it. We have to be sensible, sensitive, and sincere, the three S's, right? Sensible, sensitive, and sincere. Examiners are aware of set of phrases, right? Like they take exam almost every day of the month, right? They take exam every day of the month. They know what we're going to say. They already know it, right? They know the phrases. But now you see, you can't produce or invent new words, but you can at least say those words in context, right? You can at least say those words by, just assessing the situation. Next thing, if the examiner thinks you're using such learned behavior without interacting, you see the word interacting, without interacting with the patient in front of you, you can lose marks for interaction. They want us to interact, right? They want us to interact. But if you're using behaviors which are just simulated, which are out of context, right? Which you're just simulating, which you've learned, which are stuffed in your head, or you're just copying, then you're gonna lose marks. You're not going to gain marks by talking more, right? That's what I said, that you're not supposed to talk more, you're supposed to listen more. All right. You will, however, gain marks for listening carefully. You see what this said? This said that stop talking. This just literally said Let's stop talking. This second sentence that GMC has pointed out to us literally said, stop talking more, listen more. When you listen more, you respond better, you understand better, you understand and respond clearly, sensitively, sincerely, right? Sensitive, sincere, and and more of what the patient has come for. You respond in that way. All right. You're expected to deal with patients exactly as you would if you were the junior doctor seeing her or him in clinic, right? The clinical situations in the stations are designed to be within the capability of the junior doctor. They wouldn't want us to go for an ECG. They don't want us to go for a surgery. They don't want us to, like be the professor sorts, right? So why do most of us fail? Because, why do we fail? We fail because we talk like we're the professors. We talk like, because, we as even as junior doctors, I was given a whole ward to take care of. I didn't know anything, but I was talking to them like I was a professor. I was telling them everything. I know you guys have been through it. You don't have to act like it. You have to act like you don't know nothing and you're just learning. You're just gonna say things which are on the safe side for you and for the patient. Like little knowledge is dangerous. Here, more knowledge is dangerous. Here, more knowledge is dangerous. If you know more, you'd say more. This is why they say talk less. If you talk less, you will gain marks because you're listening more, right? That's the do's. What are the don'ts? The don'ts are, don't say everything you tell me would be kept confidential. This is just one example of what they're saying. Obviously, the patients, they are they are more they are more prone to being unconfidential when they are in presence of a doctor. You know what I'm trying to say? I'm trying to say that they'll let out secrets that they wouldn't even tell their friends, right? They wouldn't tell their mother, they wouldn't tell their daughters, they wouldn't tell their sisters or brothers, but they'll tell you. So this is expected out of you, that you're going to keep everything confidential. It's expected out of you that you would behave in a way that a doctor should. It's expected out of you that if they've come to you, then you're definitely going to ask them questions, right? So you don't need to say, is it okay if I ask you some questions, right? Because they came to you, they know you're going to ask them questions, right? You could just say that, is it okay if I chat with you about what's going on, right? Like you're going to have a chat. Questions is something you're going to do, they know it. That's why they've come to you. While medical students who talk to patients for their own learning benefit are taught that they must explain everything you will say would be kept confidential within the medical team. The patients only assume that within the consultation everything is confidential for sure, right? So don't say things which are obvious, right? Like state in the obvious. Do not state the obvious, right? Okay. You therefore do not need to say. Yeah. All right. Okay. You therefore do not need to say, do not need to say this. And indeed, it could sound odd to a patient because, when you tell him that, for example, if you were a thief, right? It's a weird example. If you were a thief and you go to your partner and, like the partner says that, I'm not going to report you to the police. That just makes it so obvious that he's going to do something about it. He's going to go behind your back and inform on you or tell on you to the cops, right? So that's just the same thing. I know it was a weird example, but it's just telling you that this is a code, right? Do not break the code. That's a code. The things which are understood, right? So the non-verbal cues are very, very important in here. Some things which are better left unsaid should be left unsaid, all right? Okay, I hope it makes some sense. So there may, however, be particular circumstances where you're supposed to say this, and that'll be appropriate. That is when the patient just says that, he's worried that you let the secret out. That's when you're going to say, all right, it's not going to be let out, right? Like, when we're telling the patient that, we're going to give you an analgesic, you need to ask them if they want an analgesic. Because if you just pretend like you're going to give them an analgesic and you don't give them an analgesic, then it's going to be a problem, right? So only say things that you're definitely going to do and supposed to do. All right. Okay. Now, see, this second phrase, the third point here says, do not say, may I ask you a personal question? Right? As we spoke about earlier, that do not that you're going to ask questions regarding diet, exercise, smoking, alcohol. The countries that we come from, right? They're drinking, alcoholism, it's a taboo, right? In UK, being a lesbian is fine, being gay is fine, right? Being a smoker is fine, being alcoholic is fine, right? However, there's a limit to it. You're going to drink only 14 units of alcohol per week, right? No more than that, right? You're going to also leave 2 gaps in a week, right? You guys know this. We have learned this in plab 1, right? So when you say, may I ask you a personal question, you're going to ask things which are not so obvious in the UK. For example, asking openly about their coital history, right? Their coital history. You're not supposed to say things like, may I ask you about your coitus, right? Not directly. Here you're going to signpost. You're going to say whatever the patient's name is, Mr. X, thank you for telling me this information. Based on what you've told me, I'm going to ask you some sets of questions which are important to be asked in order to understand what you are going through so that I may be helping you out, right? For example, the person's got an STI, he's having a discharge, and like they came to you for help, and you were telling them that I'm going to ask you some questions regarding your sex life, right? But why are you asking them? Give them a reason. Give them a reason. That's how you signpost. You want to signpost? Give them a reason. Give them a reason why you're asking the question. You're asking the question because you want to help them, right? So that's when you'd be saying that, may I ask you about your sexual life, because that's going to help me out and understand what's happening and why having the that you're having, right? This is far better because I'm asking these questions for a reason, not for fun, right? I'm not a peeping Tom. Because this is right. Okay, so don't say, may I ask you some questions? Is that okay? As in real life, you can assume that patients enlisted attend under the Mental Health Act have sought the consultation with you, and they will expect a doctor to ask questions, right? They know that the doctor is here because you're going to ask questions, right? In routine consultations, expression says, may I ask you questions? Is that okay? This is odd, right? This is odd. I mean, yes, we're going to take permission. We're going to take permission, but for the things which are out of the norm. For example, if you're going to ask about domestic violence, right? If we're going to ask about domestic violence, normally in routine consultations, we do not ask about domestic violence. But if this is a sensitive topic, right? See, in our countries, smoking is sensitive, right? Drinking is sensitive. In their countries, sexual history is sensitive, right? Domestic violence is sensitive, right? These are sensitive issues. For sensitive issues, signpost, that's what it is, right? Okay, so now, when you're going to say, and no, the only times when you're going to signpost or ask permission is when you're going to invade in their privacy, right? You're invading in their privacy. When you ask about sexual history, that's invading in the privacy. When you ask about the relationship status between the mother and a daughter, or a father and a son, where you think that there has been domestic violence, that is invasion of privacy. When you're asking about sexual history, that is invasion of privacy. So the only times when you're going to say that may I ask some personal question, or is it okay to ask these questions, is when you're trying to invade in their privacy. Not right. When you're going to examine them, you're invading their privacy. Are you supposed to ask questions of may you ask may you proceed or not, right? Otherwise, you're a doctor, you're the boss there, right? Okay. Nations of a child. This is what doctor supposed to deal with them in a way that you're talking to a child. We'll come to that. Right? When we're going to do a station. Don't refer the patient to the internet. Okay, never do that. Right? Don't ever do that, because NHS wants money, and how do they get the money? If you have, this is true, right? For any setup, any private setup that you work in, right? If you have more patients, if you deal, now you see NHS is good, right? It's like the best of the health systems in the world, UK. But what they want to do is they want us to take care of the patient. If we have more inflow of the patient, if we're taking care of them better, they're going to come back to us again, right? Do not refer them to any place else unless necessary, right? The stations are designed to be within the capability of a doctor at the level of beginning foundation year 2. In the UK, examiners want to hear what your advice is. You see, they want to see how you'd behave as a doctor, as a junior doctor, not as a senior consultant, because most of us are consultants or residents and we're already under training. So we behave like that. Here we have to behave like while we were, interns, or the first time we entered our hospitals during our 3rd years of medical schools, right? We have to behave like that. Similarly, be wary of telling that you will discuss with a senior colleague. You're supposed to do that where it's necessary, and we learn that when we're going to practice. All right. Check that you understand what you're being asked to do. So important, right? You have to understand the scenario. We're going to do one scenario and we'll see how we're doing. Make sure that you read the situation instructions, station instructions carefully. Examiners have noted that candidates have not fully grasped what the station is about. Do not assume that you know what the station is about, because we have a number of different variations on particular topics, right? For example, if there's a patient and they've got, for instance, headache. There's so many types of headaches, right? If the patient comes in with headache, they had a fall, it could be hypoglycemia. It could be that, they have an intracranial bleed. If it could be that somebody pushed them, it could be that they have a history of epilepsy or so. So lots of things can happen. Do not assume that when you get into a cubicle, you know the thing. Never assume that. Always read it carefully, and the copy is also there in the room, as it says in the next point. The station's instructions are available in the room. Do not be afraid to look at it. Again, if you're unsure, you would not be penalized for that. You see, they're nice to us. They want us to pass. They want doctors there. We're going to work like donkeys there, right? I hope you understand what I'm trying to say. They want us there. They want us to pass. They don't want to fail us on purpose. So we need to know what they want. They want us to be sincere. They want us to listen to the patient. They want us to act like a junior boss in their setup. They want us to deal with the patient as a child. They want us to talk less and listen more. Make the patient talk more. Let them tell you things, right? And they would not penalize us for asking, the examiner to hand you over the instructions of what you're supposed to do in the exam. Make sure you prepare for psychiatric stations, because suicide is very high there, and most of the job opportunities which are in the UK are regarding the psychiatric positions. All right. Be wary of offering analgesia, as we spoke of it. If the station is to elicit where there is pain, right? For example, there's a patient and they came in with acute abdomen, and you tell them, do you want an analgesic because you seem in pain? Then when you do their abdominal examination, you would not be able to elicit pain, right? That's stupid to give them analgesic at that point, even though we're going to offer in certain situations, but here you wouldn't offer because you're going to elicit pain. For example, where would you offer analgesia? For example, if the patient has a chest pain, right? You don't simulate a chest pain. You don't try to elicit a chest pain, right? But you try to elicit an abdominal pain. You know what I'm trying to say? That's when you can give them an analgesic if they want, but you would not try and give them an acute abdomen, right? When you're trying to elicit a sign. If the child is being discussed, make sure you understand the pronouns, he, she, right? He, she, very important to be understood. And also the transgenders, right? We have to see what they like to be called, right? Because, there is a problem in the transgenders. Some of them identify as she males, and some of them identify as he females. I guess that's the word. So you have to be very sure of what we're dealing with, right? Because you don't want, again, you don't want to offend them. Everybody has a right in the UK, right? They all have equal rights. So you have to be sure that you do not offend them. And the offense would also come by when you're taking their names, right? If they want to be called in a certain way, you're supposed to address to them in a certain way, right? Okay. For example, if I want to be called Dr.Hwd and you call me Dr. Hafsa, that might be offensive to me. If I say that, you call me Dr.Hwd, right? There are lots of syllables in there, but, let's move on. If you're asked to suggest a likely diagnosis to examiner, do not direct these comments to the patient. See, here's the thing. If the station does not say that talk to the examiner, don't talk to them. But if they say talk to the examiner, there are some stations where they say explain the differentials to the examiner, go for it. If it says don't, do not, right? Or if it doesn't say, then it's, already assumed that, you're not supposed to talk to the examiner. If it specifically says talk to the examiner, explain to them the diagnosis at 6 minutes or so, then you talk to them. Otherwise you won't, right? Do not invent a previous consultation or test results which will help you with the stations. Examiners will interpret this as avoiding the task required in the stations and penalize you. What does this mean? Do not invent a previous consultation or test results which will help you with the station. Meaning, do not ask them. If it's not given, do not ask them what happened earlier or what test results were there earlier. Do not make believe if there is no make believe given, right? This all is make believe, right? You have to act natural and real, but all that you're doing in that cubicle within 8 minutes is all make believe. But if it's not the part of make believe that they give you, do not do it. right? Like, don't create things there, okay? All right. If the child is not a baby, do not refer to it as a baby, right? You wouldn't call a 16-year-old a baby, which you do in India and Pakistan, right? Or Bangladesh, right? You wouldn't call that 16-year-old a baby, right? You wouldn't call that 12-year-old a baby. If he's a baby, he's a baby. If he's not a baby, he's not a baby. If she's not a baby, they're not a baby, right? So you should not say how's the baby getting to the school and is the baby able to do arithmetics, right? Because babies are not able to do arithmetics. Child, your children, your son, your daughter. The better thing to say is your son, your daughter, right? But because you're going to be more sensitive, so saying your son, your daughter would feel like you don't own the patient's feelings. You might want to take their names and call them baby instead of calling them, your son, your daughter. That just depends on what the situation is. And we're going to do stations. The station instructions will tell you how to explain what you're doing when examining a mannequin. Unless it says to do so, do not talk to the mannequin. Don't talk to the walls, right? Mannequin is lifeless. Do not talk to them. Unless they say talk to them, talk to them. If not, don't talk to them. Don't say now I'm going to put on the tourniquet and now I'm going to draw in a syringe. This might hurt a little. I hope you're going to be all right. If you feel pain, please let me know. You're talking to a mannequin. Why would you talk to them? Unless they tell you to talk to the mannequin, don't talk to the mannequin. This is psychotic, right? Just saying, just saying, just saying. This is weird, but this is psychotic. Unless they say talk to them, don't talk to them. Okay. In emergency management situations, candidates do not always know the correct protocols. Be sure you understand and remember the plab 1 things, the ALS, the BLS, the protocols of how you deal with the situation when a person has bleeding, right? Nose bleeding, how you talk to a patient when he has MI, what are the things that you're supposed to do when a patient has pulmonary edema. Do not forget that, right? It is not necessary. It is necessary not only to be familiar with these to pass these stations, but also know how to apply them effectively. Meaning, what you've learned in plab 1, you're going to apply it here, right? That's your OSCE. Behave as if you would in a real life, right? As far as possible, you should behave as you would normally, right? Do with your patients, but I'd suggest not, because in real life, we're kind of mean to our patients. The people who come from the subcontinents, the people who come from underdeveloped countries, or even USA, right? Sometimes we do not respect the patients. We do not follow the ethical codes because that's not what we see in real life, right? So here we have to behave as NHS wants us to behave in order to pass the exam. So the word normal here is a misnomer for us, because we have to be normal according to their normal, right? Normal of what the UK has to offer or take. Although the examination is an artificial environment, the examiners are judging how you would perform the task in the stations in real life, right? So they'll see how you talk to the patient in real. You just want to tell them that, you know what, I've passed plab 1, I've done my OET, I've spent lots of money, and I know how to be a doctor. And I know how to talk to a patient. I know how I'm going to be sensitive. I know how I'm going to be listening. I know how I'll deal with a patient who's going through grievance, right? Who is grieving, who is going through bereavement, a patient who's angry. I know how to deal with them. You just got to show him that, right? Examiners will not be impressed by a rehearsed preamble to the consultation. And try not to impress the examiner. If you want to impress the patient, fine, but don't impress the examiner. Candidates who act and speak naturally will impress the examiners the most. Now, be natural. See, there are two things, natural and normal, right? Be natural, right? Do not put in the accents. If you don't have it, fine. That's all right, right? Samson Swami, he has an accent, right? He has a thick accent. Dr. Mo has an Egyptian accent, right? Dr. Salehi, he has an accent, right? They have their own accents. They don't pretend. Don't pretend. Be normal. Sorry, don't be normal. Be natural. Be natural, right? Be normal according to the standards of the UK, but be natural. Do and say the things that you normally do. If you use hands normally when you talk in a consultation, go for it. If you don't use hands, don't use hands. But it's good to show some body language, right? Don't pretend to do things. For example, you will not gain marks by drawing a curtain. If there is no curtain, don't draw it, right? If there is no analgesia, do not give them analgesia, right? Okay, you don't need to pass a tissue to someone who's not showing signs of tears. This is normal. If the person's not crying, for example, you told them that you have cancer and they're fine about it, maybe they're suppressing their emotions, but they're fine about it. Do not say this, I'm very sorry, you seem in pain, this is not what you were looking for. Maybe he already knew he had cancer. Maybe he had Googled it and he knew the symptoms all along and he just wanted a confirmation from us, right? They can do that. No, patients mostly almost always know almost always kind of know their diagnosis, because this is the age of the internet, right? Thanks to Mark Zuckerberg and Elon Musk, right? What I'm trying to say here is be as natural as you can, because this is what the GMC says, and that's what we're learning here, right? Don't show mock empathy or false emotion, right? See, this is so important. Mock empathy, meaning do not pretend. If you're not the empathy, right? Do not produce a false emotion. These people, they take the exams, every day of the week. They take the exam every day of the week. They take the exam every day of the week. They know when you're acting. The actor knows when you're acting, right? That's their job. That's their job. They know when you're acting. They know when you are faking things, right? They are like, hypersensitive woman, because women, they know things, right? They know things. That's men who do too. Often when something goes wrong, right? Like in fake way. So even though this is make believe, but try to be as natural as you can and as normal as you can, according to their standards of ethics, according to their protocols, according to their UK FY2 doctors, right? You should listen to the patient again. You see, they've repeated this thing. This is gold. This whole file is gold. This is just 6 pages, but this is gold. You should be explaining this to yourself, to your colleagues, and to each other again and again. Just print this out. Print this out. Keep it in front of you. When you're bored, you should maybe just read it once in a while. Read it, highlight it. This is important. This is really, really important. They're telling you that, we want you there. We want to pay you. What do we want to pay you, right? We want you to work in our setups, right? But this is what we want you to do. Show proper support to the patients. Don't invade the role player's personal space. This just means this is written by a role player who was very annoyed because some candidate might have got chummy. They might have invaded their personal space, right, in order to just show that they care, right? That's what they're trying. That's what they're trying to say. You see, we talked about intimacy a while ago. Intimacy, right? Do not be intimate with the role player. Do not be intimate where it's not supposed to be for you to show intimacy, right? Do not flirt. Do not smile unnecessarily. Do not use your hands unnecessarily. Be normal, right? But if you're being normal is being flirty, and if you're not being normal is, invading someone's personal space, and avoid that, right? That's why I told you, be normal according to their levels of normal, but be natural, right? Be natural, all right? Okay. Don't tell the examiner how you would carry out a physical examination, right? They would, unless it says now I'm going to check their pulse. If you want to verbalize to the patient. Patient's important. Examiner is not important. See, here's the deal. If we want to pass plab 2, inshallah, we need to prioritize the patient, right? We need to prioritize the patient. We need to prioritize and put them on top. Explain them what you're doing. Explain why you're asking questions. Explain why you're telling them the diagnosis you're telling them. Explain to them. Interact with them. Tell them they're your top-notch priority, right? Telling the examiner that you would do something that you didn't do, you wouldn't get marks, right? That's obvious. If you were supposed to, in a scenario where you were, you dealt with a patient who had, for example, exophthalmos, for example, they had hyperthyroidism, and you ran out of time, so you just want to proceed further, and you told the examiner that, I'd also, I'm running out of time, I might want to proceed further, but along with, examination of the neck, I'd also try and check for lid lag. But if you didn't do that, you're not going to get marks for that. You need to verbalize to the patient that, I'm going to check your eyes now, just to see if everything is fine. But do not tell the examiner if you don't do it, right? Be natural. Be natural. Not normal, natural. Don't start the consultation with, how may I address you? We just spoke about it. right? We just spoke about it. Do not say how may I address you. This is unnatural, right? What this you can ask in different ways. May I know your name? May I confirm your name? What should I call you? Right? May I know your date of birth? Right? How may I address you is a big question. This is an open-ended question, right? Do not refer to the patient with the title and their first name, right? Here, if a patient wants to be called Mr. John, right, and you call them John, then this is where you should be a little wary of it, right? For example, somebody doesn't like to be called John by a doctor, and if you call them John when they told you not to call them John, and they want you to, give them a title, and you didn't give them a title, and you're from a third world country um, where you talk to the patients as if you're their boss, right? Then there's going to be a problem. Don't oversimplify names for the body. I don't know. I heard that you're not supposed to. You're supposed to do waterworks. You could just say, do you urinate properly? Is your pee fine? Right? Waterworks is too much. I mean, they do say it in the UK in some parts, but try to make try to make a normal conversation. This is the age of the internet. Lots of them know things, right? But you're not going to tell them that you're going to go for bilateral self-penetrative oophorectomy, because this is something that not everybody knows. They might know what an ECG is. They might know what an MRI is. They might know what an X-ray is. You wouldn't say, I'm going to do a photograph of your foot just to see if there's a fracture. No, you're going to say, I'm going to get an X-ray, right? Okay, so this is what we're supposed to not do. Make sure you know why you're doing something. See, we just spoke about it. We just spoke about it, that you're supposed to know why you're doing it. Why is it important for us to know what we're doing? Because we're going to explain to the patient that, this is why I'm doing this. This is why I'm asking this. When we know things, Albert Einstein, I guess, said that a person who explains well is the person who knows well, right? Or if you're trying to explain something and you do not explain it well, that means you don't know it well, right? Most of our professors in our med school, they just came on and read slides and went home, right? And I do respect them. We all respect them, but they didn't explain things, meaning that they didn't understand them themselves, right? Or they didn't know how to explain better. So when you explain better is when you know better, right? You only explain the things that you know better. So know why you're doing what you're doing. If you're taking a pulse, know why, so that you can tell them why we're taking a pulse, right? Later on, you'd say that I took your pulse and it was a little high. And this is why I think that you should maybe sit down, calm down, you're a little angry, right? So tell them why you're doing what you're doing. Right? In clinical examination stations, it's obvious that some candidates have learned the sequence of actions by rote. You see the word they use here? Rote, meaning you rectified it, right? You memorized it, you've commemorated it to your memory, and you do not really understand why you're doing it, right? So even though there is a sequence of doing things, don't do things which are unnatural, right? You might, when we're doing things in real life, we sometimes skip the things because we assume that it's not needed at this part. So just do things which are clear to you why you're doing it, because you're going to explain to the patient why you're doing what you're doing, right? So important. You're going to explain to the patient what you're doing, why you are doing. There are two things here: what and why. What are you doing? Why you're doing? Because you're going to explain to the patient how you came to the point that you came to. For example, if we're talking to a patient and he's lost weight, right? We're talking to the patient, he's lost weight, and we're telling them that I'm going to ask you questions about your diet, right? And it is implied that the patient knows that it's related to the weight loss that he's at. But if you explain to them that you should eat more beans and you should have more things which are full in proteins, maybe try protein bars, etc., something of the sort. When you're explaining it to them, you should tell the patient why you're doing it, because you found out that the BMI that you took earlier was low and was not of the normal gradient as should be of a person of their age, height, sex, gender, right? So explain to them. You're going to explain them, right? In stations examining practical skills such as suturing, I don't think we're going to do suturing in COVID era, but also the neurological examinations, I don't think we're going to do it. That's what Dr. Mo told us. I'm just explaining what I know, right? So we're not going to do the neurological examinations and maybe not the otoscopy, because that just involves you being very close to the patient, again invading their COVID time intimacy. You know what I'm trying to say? COVID personal space, right? I pray that there's COVID during the time when you have your exam, because there are higher chances of you passing, because you would not be doing neurological examinations. There's less burden on you, right? You're not going to do otoscopies, you're not going to do sutures, most probably, right? Maybe, most probably. You might if the time changes, and I really want the COVID to go away, but if it doesn't. In the stations examining practical skills such as suturing, candidates do not always consider preparation and the safety of the patients and others, right? This is just, they're just telling you pre-COVID time, but this is COVID time, so you need to be extra careful. It is important to cover these as well as the correct technique. Do not waste time telling the examiner. They're just telling you, do not talk to the examiner unless he wants, because the examiner is a high being. They're like, your Karam and Katib being. I don't know if you guys know what that is, but in Muslim faith, that means that these are the angels who write things, right? They write things on your left and right shoulder, and they'll present it to the God on the day of judgment. So this is what's happening. They're just there to observe what you're doing. They're just writing down marks. Just pretend they're not there, right? So if you pretend they're not there, you're more focused on the patient, right? You're being marked on practical skills. Some candidates do not give themselves enough time to complete a task, right? As we said earlier, because they have spent time telling to the examiner. Unless it says explain to the examiner, don't explain to the examiner when it comes to doing an examination of a practical skills, right? And organized consultations. The UK NHS doctors are crazy about organized consultation. They're crazy about it. They want to see if you have a nice sequence of things, right? That you don't start by asking about your family history first, instead of asking the presenting complaint or the reason why they came to the hospital. They're crazy about it, right? They don't want you to ask their sexual history first before the alcohol or the smoking, right? They don't want you to ask their traveling history before you've asked about their allergy. I mean, you can, but there's a sequence of things, and they're crazy about it. They want you to have a good consultation. If you have a good consultation, meaning if you know the sequence of things, right? You don't manage the patient at that particular point where you're supposed to not manage the patient, and you're supposed to take history. For example, if you're taking history and you do management, or if you're doing management, then you say, all right, I forgot to ask the question. Fine, it's all right. You're human. You might forget things, but if you don't forget, but if you've not forgotten things and you know the sequence, during management, do not take history, right? Okay. So the consultation should be smooth. Remember, that's what they're saying. We expect you to deal with patients exactly as you would if you were the junior doctor seeing him or her in the clinic. They're not just saying doctor, they're saying junior doctors, right? Meaning know your OCAD, know your station, know where you're from, right? You don't know anything. If you were a resident, a R4 in your country, if you were a consultant in your country, now you're taking plab 2. You need to know where you stand. You stand as a junior doctor, right? The clinical situations in the stations are designed to be within the capability of a junior doctor. So don't overdo things. If you know the surgery of a particular tumor because you're a neurosurgeon, don't explain it to them, because that's not what you get marks for. You get marks for being, less capable, right? Less capable of what your capability is right now. All right. Candidates do not always go about their consultation in a logical, organized manner. See, I told you logic, organization. We're going to inshallah prepare. Candidates who ask a question and then do not follow it up risk being as seen as acting by rote. For example, what does this last sentence mean? This is so important. Candidates who ask a question and then do not follow it up risk being seen as acting by rote, meaning if you ask the patient that, for example, the patient came in because they had an MI and now they're here for a consultation, and you ask the patient that, you were prescribed with, for example, furosemide. Then you tell them, are you taking the furosemide on time? They say, all right, I'm taking it on time. You need to ask them, how do you take it? When do you take it? Do you understand what this medication does? And are you following it up? Are you following your GP up, right? So there is an array of questions, a sequence of questions, from an open question, which was, do you take the prescribed medication, to the closed-ended questions. Meaning, if you ask a question, follow it up always in any situation, whether it be ethics, consultation, history taken, whatever. If you are asked for a differential diagnosis, do not give all the possible causes. You should have at least one or two or three or four differentials, but make sure that you don't list them, can't explain them. You will lose marks. You will lose marks even if the correct possible second diagnosis is in the list. Okay, do not give them a list. Tell them why you are saying what you're saying. Do not ask irrelevant questions, particularly where they could offend the patients. You should keep your questions focused and to the point. You will not gain credit simply for asking lots of questions. Again, they're telling you to shut up. Again, they're telling you to practice silence. Again, they're telling you to revert and go back and unlearn the things that you've learned during your life as a doctor in the countries where you're from. They're telling you, do not annoy the patient with lots of questions, right? Only ask questions which you feel are relevant to the patient's condition. By saying that, what we mean is that, for example, a patient came with chest pain. You should ask the Socrates for sure, but do not try and rule every possible disease out when a patient comes with shortness of breath or chest pain, right? Just go for things which you think are relevant to this patient, to his gender, to his age, to his situation, right? Do not ask, do not ask lots of questions. I have a bad accent. I hope you apologize me for that. There is time to complete each station. See, they're not idiots. They gave us 8 minutes and they're saying it. They're saying it. It's on us when we're practicing, inshallah. When we're going to practice, we're going to see that, each of us, I told you that there are three things: history taken, sorry, not just history taken, that's your data gathering. Data gathering has 4 marks. This includes your history, this includes your history taken, this includes your pharma diagnosis, this includes your lab investigations, this includes your management, right? Pharma diagnosis is part of data gathering in your head, right? That's just 4 marks. Then there are 4 marks for management skills, right? Which would include you telling the diagnosis, you explaining to the patient something that you're supposed to do, you explaining the management plan, right? You interacting with the patient. That is 4 marks. And if you act like a robot or a robot, whatever you want to call that, I don't have a good pronunciation for that word. And if you act like a person who's got rote memory or you've just memorized things, if you act insensitive, you're going to lose your marks. So 2 ways to pass this exam are: number 1, be natural; number 2, have good interpersonal skills, meaning be empathetic, but don't be fake, right? Be natural, you know, be natural, not normal, natural, right? Being natural and normal is different, right? What is natural? You see, being natural is, for example, a normal for a person who has seen lots of deaths is to, for example, there's a neurosurgeon, right? And a norm for them is to see comatose patients every day. Maybe you're a neurosurgeon, maybe you are a pediatrician, and you see ugly patients covered in poo every day. That's normal for you, and you'd be like, all right, I'm going to see, right? Maybe you're unaffected. That is your normal, right? I don't want you to be that normal. They want you to be natural. What is natural? If for the first time you look at a patient who's comatose, you feel bad for them. That's your natural, right? That's your natural. That's what nature tells you. Nature, in reality, we are empathetic. We feel for the patient. Yes, over the course of time, we lose it because that becomes our norm, right? Initially, if you're a gynecologist, you're eaten where you're doing a cesarean. You're eaten where you're doing an NVD, normal vaginal delivery, right? And you're eaten there, right? You're taking biryani, you're taking pizza, you're eating it there, right? But that is your normal. But in natural circumstances, for the first time when you saw it, you wanted to puke, right? When you first time saw the blood, you wanted to puke, unless you were normal of the sorts where you wanted to be a surgeon and you said that, it's all right for me, it's normal for me to see blood, right? So not normal, natural, right? They're normal according to their standards, but natural according to what the nature wants you to be, right? Understand that. So there is time to complete each station. They're not idiots. They gave you 8 minutes because they thought that, if you're calm, if you're logical, you're definitely going to understand and get through it, because it's something that all their UK graduates who are FY2s do. So they expect you to do the same. And there are lots of people who've passed this exam in the past from your countries, from your families, from your colleagues. So it's definitely a doable exam. You have done examinations before, you took history before. So it's definitely something you can do, right? But you need to understand what you're doing at that very moment. Some candidates spend the final 30 seconds stating what they would have done if they could have done, if they were given extra time. Don't do that. If you are going to do it, tell them. If you're not going to do it, don't tell them, just do it. Okay, if you run out of time, do not stay in the station, because you're supposed to move, and forget about the times when we I know most of us have the habit of just sitting because we feel like we're going to get marks. We're not. Move to the next thing. This is they are telling you how to live our life, right? They're telling us to move on, right? They're telling us to move to the next thing, right? So this is the plab 2 thing of do's and not to do's via GMC. Examiners top tips on how to avoid common errors, not what to do but what not to do. If you know what not to do, then you're almost there, right? If in life you know what not to do, you're almost there. So we're going to take a break, I guess, and then we're going to come back and we're going to do stations on CVS. Hopefully that's all right with all of you, and I'm hoping you guys understood something and that I didn't speak a lot, right? I'm also learning. I have my exams soon, but what I know, I'm trying to pass it on for free this time, right? So good luck, and we'll be back in almost 10 minutes, right? Let's do that. Okay, anybody has any questions? If they are in my capacity, I'll definitely answer. Any questions? We're going to come back and do CVS stations. Any questions at all? Or was this boring? Okay, no questions?
I have a question, Doctor. You said that an organized consultation. So what does it mean by an organized consultation? We have to, you said, go step by step. So can you tell me?
Yeah, definitely. See, all right. Where to find this PDF? This is on the GMC website, and I've also sent it. This is your organized consultation thingy. Let's look into it, right? That's a good question, I guess. This is your organized consultation, right? Okay, now I'm going to send this, and I've already sent this, right? This is your organized consultation. I don't know how to tilt this one, but right, like organized consultation meaning, do not start by examination. If you're supposed to start by history, don't start by examination. If you are supposed to start by management, don't start from history, right? Depending on what has happened in the situation. Organized consultation meaning you should do the things in which they're supposed to be done, right? Like when you were a junior doctor, you always started by, good morning, this is Dr. This and this. May I confirm your name and date of birth, right? That's your normal consultation. Then you moved to the history, whatever it was. If the patient has been diagnosed, you ask them, right? What brought you to the hospital earlier? What happened earlier? Why are you here again? Right? That is a normal. You don't just directly examine them. So that is your organized consultation. We're going to do some scenarios, and that's how you learn how to do an organized consultation. Mean and follow the structure of things, right? There are different structures given in different notes. Aspire, Dr. Mo, Samson. Just follow them and see how they do a consultation. And that is not something that you can read. That is something that you're supposed to do, because this is a practical exam, right? That's what it means by organized consultation. Meaning, over here, you see, these are the feedback criteria, right? This is what they assess us on. They look at if we were having a smooth consultation, the flow, the history, the order, if we were being the safe doctor, right? Repo, meaning are you being empathetic, if you are understanding, if you're reassuring. Issues, if you identified the issues, if you addressed the issues, if you resolve the issues of the patient. We're going to do this, inshallah, and we're going to assess each other through these 10 basics of what the examiners are giving us feedback on, right? Findings, pick up the verbal, non-verbal. Examination, if we're doing it well. Diagnosis, if we explain them without the jargon. If we're honest in accepting the diagnosis. Management, medical, non-medical, language, free from prejudice, so important, free from prejudice, forceful, impediment, jargon, heavy accent. I mean, accent's fine, but don't have a heavy accent, right? Like simplify so that they can understand. Listen in, right? Both telling them you're listening by or just nod in time. Yes, it's been recorded and it's going to be uploaded. All right. Okay. So I think we're going to take a break unless you guys have a question. Be always honest, have open questions, don't interrupt the patient, read the question carefully, and communication is key. Yeah, you're doing it because you want to communicate. Where to find this PDF? Thank you, Dr. Rahman. I've sent you this PDF. All right. So we're going to end it. We're going to take a 10 minutes break, and then we're going to come back and do some stations on CVS. Right, guys? Hopefully that's all right with you. Unless you guys have any questions, please